Hello, everyone. Today we have on a very special guest, Pastor Harrod at First United Methodist Church. Mr. Harrod, how are you?
I'm well, how are you?
Good, thank you for asking. You're here today because you're the recovery pastor at First United Methodist Church. You work with individuals suffering from substance abuse disorder, among other things, and we were hoping to tell your story and how you got to this position and who you work with.
Okay.
So my first question is, where does your story with addiction start?
For myself? So, for myself, the short version of it is with lots of people with substance use disorder, there's a gateway. We used to talk about gateway drugs like alcohol or marijuana, but what we've learned more so is that trauma is a tremendous gateway, and that was my story. Childhood trauma. I don't know if you've heard of the ACEs test, the Adverse Childhood Experiences. And it's a list of 10 questions that, if you have 4 or more ACEs, I think it's something like an 80% increased chance of substance use or self-harm, mental health, severe mental health issues, and even suicide attempts. So childhood trauma was my thing, including spiritual abuse, which is ironic that I'm now a pastor. But so I turned to drugs to just numb that, and I guess started using when I was about 12, and had a lot of, that was my go-to coping mechanism. I don't think I had any healthy coping mechanisms, and continued that until the first time I entered treatment. I was 19 years old, was already married at the time and had a son, and I didn't even know the word addiction, didn't know what chemical dependence was. As far as I had experienced withdrawal symptoms, that's when it really became a different kind of ball game with certain classifications of drugs like opiates. You wake up one day and suddenly you're sick if you don't take it, and that was kind of a game changer for me, and continued trauma, and just, I think I was in and out of treatment probably 11 times or more. Part of that, we talk about substance use disorder as a holistic disease, or a holistic disorder that affects mind, body, and spirit. A big part of that for me, I have co-occurring disorder with also with bipolar, and so that's kind of a which came first, the chicken or the egg situation. But with co-occurring disorder, so it just kind of compounded onto itself, and I was agnostic or atheist. I believed in something, but wasn't sure what, and wasn't sure that based on my experience, the childhood trauma piece, wasn't so sure that God was good, and wasn't so sure that I wanted any part of what I had, the way Christianity had been represented to me. So it took on up until my really until I hit 40 years old, and until a series of bottoms that continued to get lower, a series of consequences of the behaviors that come with substance use, and and finally had an experience with God as I understand Him, which that's Jesus for me today. For a long time, I had no idea what that looked like, but had an experience actually in the back of a transport van from the regional jail to Carroll County. It was on a December 23rd, and I was going for a bond hearing, and powerlessness is a word that we use a lot in recovery. And so I was shackled for the purposes of being transported, and your hands are kind of this close together where you can't even really reach up and scratch your nose. And it was just a realization that I had zero control over the situation, and kind of a moment of clarity that I believe God came to me in that moment, and I realized that I was powerless, and that I did need to surrender my life and my will to God. And I said a prayer in the back of that van, and my life hasn't been the same since. And so that was the beginning, and that was 10 years ago and some change. And I would love to say that, I've been perfect the past 10 years, but when you lived a certain lifestyle and lived a certain way, and when we begin to use drugs, then we stop developing socially, and I think there's research that indicates once an individual, I was a polysubstance addict, which means I used anything and everything, but primarily it was opioids and methamphetamine. So we now know that the brain can and will heal, but that process is just that. It's a process. So, I was under the impression, if I just take the drugs off the table, then life will suddenly get easier, and that was not the case. I had to learn how to live as an adult and as a law-abiding, productive member of society, and to go back in and heal a lot of the trauma that I had gone through. And so after about, I think, a year and a half, 2 years, I had a relapse, and which was a really powerful learning experience for me. Yeah. As someone who struggles with, or has struggled with substance use, I know this is common to a lot of folks that I work with and talk with. There's always there comes this voice in the back of your head that I can use successfully one more time. And I had been through that previously, but I had never had sustained recovery for a year and a half, and begun to see improvements, develop my relationship with God, had a support community. My life looked different than it ever had before, but I still had that nagging, oh, you can do it one more time. And that one more time turned into a couple week run, and so now it's I've had sustained recovery for just over 8 years and 2 months now. Congrats. So and I continue. We talk all the time about progress, not perfection.
Mm-hmm.
So there are still things that I'm learning, um, but that is it in a nutshell, without going into the gore of it.
Sure. Do you remember what the first step was in that process? Did you go to a Narcotics Anonymous group? Did you reach out to a religious or spiritual figure?
When when I decided to that.
Hmm.
Um,
After that literal come to Jesus moment.
okay, yeah. So the first step, and this is so Recovery United is the program that we have here at First United Methodist. Um, there there was a program called Recovery at Hillsville that met at Out of the Box Worship Center on Main Street, and there was a friend of mine who was recovery pastor there at the time. My daughter went to that church, and I remember I would go and take her on a Wednesday night, which is when they met, and he would always be after me to stay, and because of the church hurt that I had, I was just kind of gun shy when it came to getting back involved with organized religion. Eventually, my wife, Melanie, began to attend those meetings, and she came back with a very different experience and stories about people just receiving her in love for who she was, exactly where she was, the compassion that those folks showed to her, and that had an impression on me. So I decided to give it a shot, and and then from there, also there was a Celebrate Recovery meeting going on at Blue Ridge at the same time. So we began to attend that. I've also been in the rooms of Narcotics Anonymous and Alcoholics Anonymous. For me, therapy is an incredibly important piece of my recovery. Um, here we believe in person-centered recovery. That there is no cookie cutter way. I've tried all those cookie cutter ways, and they ended the same way every time. So, but for me, that is how it happened. It really was synonymous. It went hand in hand. Oftentimes, I've heard people refer to substance use disorder as a spiritual disease, and one of the ways we describe it is, we have a God-shaped void in our life that we're trying to fill with whatever. Some people fill it with food, or you have other addictions, porn addiction, gambling addiction, but it all comes from the same void. And once that I address that the spiritual aspect of holistic recovery is when I really began to see the change. And I'm super grateful for the rooms of Narcotics Anonymous, Alcoholics Anonymous, and Celebrate Recovery, because there was just an overwhelming sense of hopelessness for me as a man in his late 30s who had been divorced twice due to my substance use, and lost relationship with children, and just the wreckage of the past. It can become a very hopeless situation that you can't see your way out of, and that's another thing that we really hit on here, is that there is hope, and so that is really what got me in the door, what kept me there, and what has sustained me these past 10 years. Because even after the relapse, I've had relapses that lasted 6 years because the shame cycle, when a person goes back out and uses, oftentimes due to stigma, due to various different things, there's just a mentality of I cannot beat this, my life will never, there is no hope for me, essentially. But due to the support system I had, the people around me, my family even, I, for the first time ever, didn't stay and wallow in my misery. And there's a terminology, rigorous honesty. Deception, lying, manipulation often go hand in hand with substance use, and that was one of the patterns that I had to learn to break. And so I remember the inner turmoil about confessing the fact that I had relapsed to people, and I just thought everyone would essentially give up, or that I would be shunned or outcast in some way, but that was the furthest thing from the truth. And so they pressed in even more and walked beside me through getting back on my feet and looking for where the holes were in my program that I was working to avoid that same mistake again.
If an individual approaches you in your group wanting to start their path, their process, where does that begin?
So, as I mentioned before, the person-centered piece is important to us. And so if a person came in today, I would see where they are in their use history, what they're using, how long they've been using, if they desire treatment, and what type of treatment, if so, what type of treatment may be appropriate for them. And then we would have a list of over 200 places just in Virginia and North Carolina that we can refer people to, and much less nationwide. We can also call whoever their insurance provider is, or we can refer them to Mount Rogers. We've yet to work with this new outpatient group or the new program at Twin County. But really it's we would ask them their goal. I would ask them their goal and then follow their desire, what they want their recovery to look like, and I don't know if you've heard the term peer support. It's based on lived experience, kind of just walking with the individual through the process, advocating for the individual until they learn to advocate for themselves, helping in situations like employment, housing, treatment resources, referring to a clinician like a counselor. Sometimes medication-assisted treatment is an option for some people, and basically so if we were talking about it in Christian terms, we would talk about discipleship. It's just being present with the individual, sharing my own experience, strength, and hope. The group that we have here that meets on Tuesdays is also a big part of that. There is a lot of power in community. When we're in substance use, we hang around people that are using all the time. and that may be the only thing we have in common. So it's equally, well, I would say it's more so important that when you're entering into recovery, that you surround yourself with people who are heading the same direction that you want to head. And then we move on into things like meetings and step work and addressing the holistic nature. A lot of people have let their health care slip by the wayside, and so we just try to see what the individual needs and see how we can help them achieve their goals.
Yeah, I'm glad you brought up MAT, or medication-assisted treatment. Recently we had Beth Macy's Dope Sick, which I'm sure you're familiar with.
Yes.
And one of the methods that she's a big proponent of is MAT. And
Yeah.
I realize it's a little bit more controversial in some groups than others. And I was curious about this program's use, and I guess if it supports its use or not.
We support people not dying from addiction.
Yeah.
And we support breaking the stigma, and we support compassion and approaching each individual exactly where they are, not where we think they should be. Medication-assisted treatment, it is a controversial thing. It's harm reduction is another very controversial topic in the recovery community, especially in this area. Medication-assisted treatment, I think, definitely has its place in for some folks in recovery. I've worked in a treatment center where I've seen the downside of medication-assisted treatment, where they're either the prescriber, it could be inadvertently overdosing the patient, like giving too much of the medication, and it's not intended to be a substitute, but it's intended to be a tool to help you get eventually to a place of abstinence.
And obviously, Recovery United has a more spiritual focus. You've mentioned it several times. If someone comes to you who's not religious or not spiritual, how do you work with them? Is the goal to have them become a spiritual individual, or do you just work with them through the treatment process where they are?
We have the saying, you don't have to believe to belong. If you look at how Jesus ministered, he did not require people to believe like he believed to minister to them. We approach each individual exactly where they're at, and we don't require that anyone conform. We don't use the Word of God as a blunt instrument to make people feel guilty. And we have people who have been a part of this group for 5 years or more who don't practice the Christian faith, and that's fine. We still love them, and we still provide the same services. It's not our primary. It's not a mandatory thing that you be a believer to be a part of the group, and we don't want to force. We don't want to make anybody uncomfortable. So. Does that answer the question? Yeah,
it does. I was curious because obviously you're in a church, it's a
right.
religious setting, but it's good to know that non-religious people are welcomed.
Absolutely welcomed. And just like AA and NA, they talk about being spiritual and not religious. What I learned for myself as a person who came up in the church is that there is a tremendous difference between religion and relationship. What recovery, the spiritual nature of recovery requires is relationship with a higher power, a power greater than ourselves. And so we do still talk about the spiritual component of recovery, but we don't and never would require anyone to believe the way we believe. But we still do address the need to find a power greater than ourselves and greater than drugs, preferably a higher power that is loving and forgiving, because we want people to know that they have inherent value and that they are not less than. The substance use disorder and mental health struggles are not a moral deficiency, and so those are things that we press into pretty hard, to let people know that you are loved, you are important, you are valuable, and there is hope for you, regardless of, and that doesn't hinge on how you believe.
Certainly. Last year, around this time of year, I had the opportunity to work with Judge Giesler and Judge Harrod in Galax for their recovery fitness sessions.
Yes.
I'm sure there's some cross-pollination between your group and their group. Can you talk a little bit about the role of their program in the overall recovery process?
I think it's great. I think it's tremendous. They join us one Tuesday a month. They come in and to Recovery United, and it's we have people that have become regular attendees after they've graduated. I think the more, in my experience, the more time that you are away from substance use, and the more positive input that you have, the more positive community you have, when you really start to look at the root issues. We believe that substance use and the drugs themselves is not the root issue, but it's a manifestation of a deeper issue, and oftentimes through therapy and through even these mutual support groups such as NAAA and our group, we're able, and through working the steps, we're able to get to those root causes, and people are able to experience healing. I love the way that the judges work out with the guys and gals in the recovery court.
It's hard work. The workouts are tough.
Yes, and that's something that we're getting ready to start is a physical wellness component of our program with Blue Mountain.
Okay, yeah.
So yeah, that's something we're really excited for. But no, I think the recovery court is tremendous, and I think it helps fight the stigma in the area. And I think I know for myself that the guilt and shame was a big struggle that often kept me digging the hole deeper. It would often keep me in my addiction, as opposed to because I just felt like there was no hope. And I feel like programs like Recovery Court help people see their value and see that they do have positive things that they can contribute. And again, it reinstills worth and value into the person.
Yeah. When I went and worked out with them, it was really neat to see everyone working together.
Right.
They had that common fellowship, that common purpose and goal, and there was very much a sense of, hey, we're here, we're not perfect, but we're doing it. We're working the process.
Right.
We're trying to get there. And at the end, Judge Harrod, he read an excerpt from Meditations by Marcus Aurelius. So not a Christian
Right.
text, but it's still a philosophical text that encourages becoming better. And I thought that was a very nice way to cap the session off. And,
Yeah, absolutely.
Leave the participants with more than just sore muscles, but leave them with something mental to think about for the next week.
Absolutely. And I love the fact that they're addressing it from a holistic standpoint as well. And that is something we do sometimes pull from biblical text and use pull from the text to see how it relates to our lives in recovery. And we also read from different meditation books that may be put out by NA and AA and incorporate some biblical principles that go along with the 12 steps of AA and NA.
I was kind of curious, as someone who's not really that familiar with NA or AA, just besides knowing that they exist and that they follow the steps, how does your program differ, and how is it similar to those?
Wow, how does it differ? I would say ours has because we are faith-based at our root, and we are unapologetically faith-based. A lot of us here, like I can say for me personally, at least, I felt like I had tried every avenue of recovery that the world had to offer, and there was still something missing. So we feel like the spiritual component is an incredibly important piece of it. A lot of the meetings that in my early recovery that I attended in AA and NA, it just seemed to be that piece of it would always bring up some contention in the room about this person wants to sometimes maybe get on a soapbox about who their higher power is, and that can be inflammatory when you have other people in the room who don't believe that same way, and the character defects are a part. Discovering what our character defects are, and then dealing with those are a part of it. My personal experience in NA and AA was I came across individuals who may be described as dry drunks, or they white knuckling it, which means they were abstinent, but they were not experiencing what I would call sobriety or recovery, which is a sense of peace and well-being, overall well-being that comes along with that abstinence. I don't know if that makes sense or not.
No, it does.
And so we focus on holistic wellness. Like we want you to be well physically. We want you to be well mentally, and we want you to be well spiritually. And since I'm blessed to be able to do this full time, I get to meet with people individually, and those who do believe differently, we still engage in conversation about spiritual things, and I respect their beliefs and don't try to sway them to believe like I believe. So that would be the primary difference, I would think. There are folks who believe in some fellowships that if you are taking MAT in any way, shape, or form, then you are not clean or sober. And we like the word recovery because recovery means different things to different people. Mm-hmm. Are you familiar with harm reduction at all?
I'm not totally familiar. Harm reduction is one of the terms I've heard of, but
right.
don't really have full context for.
So harm reduction runs the whole gamut too, from needle exchange programs in the bigger cities and some other areas into Narcan trainings. Yeah. One of the things that is alarming, I'm also a certified peer recovery specialist and went to a conference fairly recently where we had a group called the Savage Sisters, came down from Kensington, Philadelphia, which had a tremendous drug use problem there. The drug supply is tainted with fentanyl and xylazine and these new either veterinary medicine the drugs are being cut with, and I'm super grateful that I'm in recovery now, because the conversation that I have with my daughter, who is a teenager, is that you can't, you're playing Russian roulette when you choose to experiment in this day and age. The drug supply is, I think at that conference there was a harm reduction group from Roanoke that said of the street drugs that they had tested with fentanyl test strips, that it was between, if I'm not misspeaking, it was between 80 and 90% of the drugs that they tested contained fentanyl and or xylazine. So, and we're seeing that become more local as Pulaski County and Galax Wythe County. What I know about drug supply from my days in active addiction is that if it's in Pulaski County, if it's in Wythe County, if it's in Galax, then it's in Carroll County. We just want people to know, and our primary, one of our primary things is we love you enough that we want you to live, and so however we can work with you towards that end is how we want to work with you, without enabling, of course.
Yeah, definitely. Yeah, that is a hard line. Some criticisms I've heard of harm reduction is that, well, yes, it does make the user safer. It might encourage further use, and that is a very challenging question to ask and to think about. And I'm not really sure what the right answer is, and I'm not sure there is a right answer.
Right.
But it's something to consider.
Right, absolutely.
Briefly before we started the interview, we discussed L.A.
Yeah.
I traveled to L.A. for a school trip, and while we were on the metro, we saw someone who had overdosed. I asked him if it was fentanyl. I saw them doing the fentanyl lean that you'll see on social media.
Sure.
And I was able to get help from them via the See Something, Say Something text messaging thing they have on the metro. But that experience just kind of stuck with me. It made me think, well, this really is like a global or nationwide problem. You hear about it like on the news. It's like, yes. They throw out a statistic, but I see the problem here in Carroll
yes.
County, in Galax locally. I see it in North Carolina, West Virginia.
Yes.
But then I go to California too, and then I see the same problem, and it's hard.
Absolutely.
It's a big challenge for society to solve.
Absolutely.
And, it takes
yes.
a lot of people like yourself, like Judge Kiesling, Judge Harrod,
yes.
and other peer support groups to tackle it. So.
Yes, sir. Absolutely. And it is one of the things that we've learned the longer we've been in operation is, and I think we were actually in a meeting with a director of DSS that was talking about, children being removed from the homes, and the percentage of those removals is for the most, it's again up in the 80-90% range of the reason being substance use. And then she went on to tell us that there were situations where you try to place the child with a family member, where there were families where 5 or 6 people could not pass the drug test. So it unfortunately, we're a very rural area.
Yeah.
It doesn't get the press or the eyes on it that it does in the city. We're also very widespread as a county, so the town of Hillsville in and of itself is not a very large town, but in the 26 years that I used, I never went to the city to get my dope. It was always right around here. So, we went through the opioid epidemic. Meth has been an issue here for, I guess, since 2000. And we could probably go back and pull the Carroll News and Gazettes and look at the indictments from 2000 on, and see the overwhelming majority of those indictments are going to be directly linked to drug possession or something to do with substance use. And my experience has been the other 20% are generally 1 to 2 steps removed from substance use. So it really is a health crisis that we're facing. Unfortunately, there is a stigma attached to substance use disorder and mental illness because of the behaviors that come along with it. And I fear that sometimes people just give up on folks who are struggling with substance abuse, or it becomes easier for us to look away because of the behaviors. And that is another one of our primary goals, and meeting people where they are with compassion and just hope, like giving them hope. Like if people who knew me before I got into recovery, and I've had this happen multiple times when people come into the meeting and they see me and their mind is blown because I am not the same person today that I was in my addiction, and that's true for every single person that comes through and sticks around. They become a different person who they truly are, and we know the physiological effect that substance use has on the brain. I think I've heard it referred to as reptile brain or survival brain, the prefrontal cortex where we have our brake pedal. It doesn't, that brake pedal stops working, and the mind, the brain, it becomes about survival mode and where am I going to get my next fix, and that becomes an automated thing, and people lose the power of choice at some point. And I know that people who don't have lived experience in that can be a hard thing to understand. And that's another goal we have, is to try to educate and family members and the community, as to and just break that stigma and help people see that this is a human problem, and that these are people who love their kids, and who are loved by their kids, and if we can do something to intervene and bring healing into their lives, then I've never met a dom addict. Most of the people that come into recovery and have long-term recovery are some of the most creative and most intelligent, resourceful people. The shame is that many people remain in that hopelessness because they don't think it's possible for them. We get other people's voices, going back to the trauma piece and the abuse piece that is many times synonymous with substance use. Whoever the abuser may have been, their voice eventually becomes our own voice, and we begin to tell ourselves that we're worthless and that we have no value, and again, that just keeps us in that shame cycle, and we just keep digging that hole deeper. So anything that we can do to help people get out of that is rewarding. And substance use is a thing where I think the recidivism rate or relapse rate is about 80% with most substances. So it is something where you're going to see people fall and come back, and I guess some people, that helps them, or makes it easier for them to write people off as hopeless, but that's just not the case, and that's I'm just so grateful for my family and the people in my life that didn't give up on me.
One of the questions I had coming into this interview was how your experiences with addiction have shaped your process with treating and helping others. You must have a very unique perspective on the subject as opposed to someone who does a similar job to you but doesn't have experience with addiction themselves.
Lived experience with, so I can go back to when I was coming through treatment centers, and I cannot describe, there are not words to say how badly I wanted to not be addicted. But the process seemed so impossible. But my experience in treatment centers was that people who were working in the substance abuse field, who were in recovery themselves, I found them to be more helpful and also be a beacon of hope. Like if they can obtain recovery and stay in recovery, then it's possible for me. And I think that's what I see when I have someone come into the office and sit down across for me, and they start to tell me what's going on in their life. Then I'm able to share. Yes, I experienced that same thing, and I think it allows me a certain level of empathy that other people don't have or are not able to have because they haven't experienced it, and also gives the person in that seat hope that they're sitting across from someone who has experienced it, who is now in a position to and willing to walk them, not just sit and have a conversation, not just make a phone call, not just give them lip service, but willing to walk with them through the process as much as they're willing to allow us to do. And that's really the commitment is we are willing to walk with you through the process, and that's one of the benefits I think of lived experience is just that extra level of compassion and the extra hope it brings to the individual that we're trying to serve.
Is that hard for you to put yourself in that position and listen to those experiences after you've beaten them?
So that's a good question. Hard in what way?
I guess just mentally.
It's hard to see people fail.
Yeah.
It's hard to lose people to overdose.
I guess the question I'm asking is to have that ability to hold the empathy for others when, if I had went through that, I would just want to, once I'd beaten it, I would want to get away from it, I think, to
I see what you're saying.
reduce the risk of a
Right.
potential relapse. But you're willingly putting yourself in a position where you're confronted with it every day, and
Right.
you have to be strong enough to continue.
Right. No, honestly, Ethan, I can't see myself doing anything else ever as long as I live because of the living hell that my life was in when I was in active addiction. And we look at it and talk about it a lot of times like it's an opportunity to plant a seed in someone's life. There were people throughout my active addiction that, even when I was in my early 20s, that would say things to me, and no, I didn't get clean that year, or I didn't enter recovery that year, but to this day, I can remember what that individual sowed into my life. And were it not for people like that willing to sow in, then I may not be where I am today. And so I don't find it hard. There are moments that are hard. There are always moments that are hard. There are times when I wish I could do it for them. There are times when, I've communicated with someone and been attempting to you can't force anybody to do anything, but making strong suggestion that you may want to enter a treatment center. And then days or weeks later hear that they've had a fatal overdose. Those are hard. That's the hardest part. But as far as exposing myself to it, no, I don't find that difficult. Self-care for me is an important piece. If I were not working a program myself, if I hadn't surrounded myself with my own support group, if I didn't have accountability for myself, my wife and I are both in recovery. We met in active addiction, and both entered recovery around the same time, and that is an incredible help to me. She also is a big part of Recovery United, and so community, like you mentioned with the recovery court, that you had witnessed the power of community. I've heard it said the opposite of addiction is community. I don't know if you know the cocaine rat. The cocaine rat experiment back in the 70s, maybe, where it was one rat and they had a water bottle filled with either they had added either cocaine or heroin, I think, and the rat would just continue to go to it. it eventually died, is the moral of the story. And then somebody saw that, those results, came back and added an element of community where there were other mice in the scenario, and activities like a wheel for it to run on, or mazes, or and the outcome was different. It would come back sometimes, but gradually it didn't come back anymore. And that's what we find to be true, is when we're able to address the root issue, heal, find our value, and have that spiritual connection with God, however we understand God. Then I'm the happiest I've ever been in my entire life, and to experience some of the losses that I have in my life due to addiction, I did not think this level of happiness was, or wellness was possible. The fact that there was about a 2-year span where I could not leave my house, period. I entered drug-induced psychosis, and was diagnosed with some mental health diagnoses, and put on a bunch of medications, and thought this is my lot for the rest of my life. But in my world, God had other plans, and so I got into recovery, became willing to take suggestion, became willing to surrender my life, and to do things differently. There's an old saying that if nothing changes, nothing changes, and so that's a big barrier to recovery, I think, for some people, is that we don't like change. Good stress and bad stress are still stress. We've seen people relapse because their life, they come out of active addiction, and suddenly they get a job, and maybe they get a promotion, and maybe they start to go back to school, and in some way they've neglected their self-care, and they become overwhelmed with good stress. And unfortunately, when you've done something for 26 years, it kind of becomes your default. And so it's like an alligator kind of rolling back into that comfortable swamp for it. But no, I couldn't be happier, and never imagined that I would be in this position today.
We've talked a lot about community.
Yes.
One of the ways that your program really helps facilitate participation and embeds that sense of community is the child care that you offer your participants. I've had the opportunity to help out a few times with that through our local Rotary and Interact clubs.
Yes.
But essentially, participants can come, leave their children to be watched over, to do activities with, just in a safe, supportive environment, so that they can focus on getting better.
Yes.
How did that aspect of the program come about, and can you talk about its importance?
So the importance, and this is really my main point of it, is generational curses. I don't know if you're familiar with that term. Also modeled behavior. Also, as we mentioned before, ACEs. A lot of these kids, when their parents were in active addiction, may have experienced trauma. We believe that if we can begin to interact with these children and provide positive interactions, that we may be able to prevent them from having to experience or following in the footsteps of family patterns. And so we like to become involved in their lives early. And I know for me, I grew up in a house where my father wasn't present for good reason, and there was no male role model in my life to model for me what it looks like to be to interact with his child in a healthy manner, to interact with his wife in a healthy manner, to interact with society in a healthy manner, how to be a man, really. And so those are things that we see having that child care and having that interaction, having you guys from Interact come, especially for our young men who are here, that it's just, we're trying to set them on the right path and create some positive interactions, and also give them an environment in which they can express themselves, and if behavioral things come up, then we can be a part of the solution there as well, and oftentimes that looks like referrals, or it looks like walking with the family. If there is an intervention from an outside agency, then it looks like walking with the family through that, and so we don't just want to support the individual. We want to support the whole family, and when possible and appropriate, bring healing to the whole family. And we're super grateful for the Interact program and the involvement. Last night we had 2 or 3 Interact folks with us, and the kids love every Tuesday when they see you guys coming through, and it just gives them, it's kind of like the mentorship, I guess, like the old school Big Brother program, you know. They really do look forward to that time, and they cherish that time.
Certainly. On that note, if your kids are listening to this episode in 50 years, what would you want to tell them?
Oh my goodness. My children.
Yeah.
Oh wow. My kids listening to this episode in 50 years. 50 years. I'm proud of you. And I love you. And appreciate your patience with me and forgiveness. I put my kids through a lot of trauma when I was in active addiction, and which is hard as a father. That's one of the hard things to overcome as a parent who has been through active addiction, with children involved, and then when a divorce occurs and that relationship is severed, you know, it was nothing. This I cannot emphasize enough. It was nothing that any of my children ever did that made me go away. It was my own sickness, my own pain, and in no way, shape, or form was it anything or anything they lacked. And I think that is, I can't emphasize that enough. And that I'm truly and honestly sorry for any pain that I put them through. But my children thankfully have been super resilient, and and um, and I'm grateful for where they are today. And I can only imagine where they'll be in 50 years. So it would be interesting to see.
It's a fun thought experiment for sure.
Yeah, absolutely.
If an individual is listening to this episode and they want to start their process on recovery, how can they get in contact with you? Where can they start?
They can contact me. And can I give my phone number?
Sure, yeah. If you're comfortable.
You can contact me at 276-266-0264. You can also come every Tuesday night, even if it's Christmas Eve or the 4th of July or New Year's Eve. Every Tuesday night at 225 Fulcher Street, we will have a meeting. You don't have to be sober to attend that meeting. Tell people all the time, if I understand, if you need to, if you're in active addiction and you need to use to get here, just get here. We ask you not to bring it in with you. But you will not be judged. You will be accepted without condition, and we will do everything in our power to help you. And we have resources available. Don't think that because you don't have insurance or because you don't have money that disqualifies you from recovery, because it doesn't. We have recently kicked off and gotten started a nonprofit, Grace and Gratitude. We're incorporated in the state of Virginia. I've written a couple of grants, and so that's a program that we are building, that we hope to be able to provide more programs, provide more recovery services. So yes, just reach out and contact me, or just show up Tuesday night at 6:30. We do have a Facebook page, Recovery United, and I can meet you. You can come here. I have office hours, no privacy, and anonymity. And let me stress this while I have a chance. Anonymity is very important to folks in recovery. Any conversation that you have with me is 100% confidential, other than instances of mandated reporting. So we're not going to put your business out there. It's our only interest is to help you in your recovery.
Is there anything else that I haven't brought up that you would like to mention?
So we've talked a lot about we've focused I think primarily on the substance abuse piece. We also have people come who are who have significant mental health diagnoses and are in recovery from their mental health diagnoses. And so we also work with folks who are experiencing mental health issues. That's something for people to be aware of as well. There's also a tremendous amount of stigma there at times. I also have lived experience in that, so if you're looking for a compassionate care, sympathetic ear, person-centered, and someone who will walk with you through the fire, then please reach out.
And that was going to be one of my questions. I understand that a lot of times substance use disorder and mental health disorders go hand in hand.
Absolutely.
They're co-occurring. And I was just kind of curious about the general treatment of a co-occurring disorder.
So I can give you my personal experience. Co-occurring, a lot of my, besides the trauma, the trauma piece, a lot of my substance use was actually self-medication. I had a tremendous amount of anxiety, and also some depression. Later was diagnosed with bipolar. What I was doing is if I felt too low, then I was taking a drug to make me feel higher. If I felt too high, I was taking a drug to bring me lower. Mm-hmm. That is what a lot of people are doing, is is doctoring themselves with illicit drugs or even pharmaceuticals that they're buying off other people. And while I'm on that point, the danger of fentanyl pressed pills is becoming something that people need to be aware of. That 2 milligram dose of fentanyl will overdose, is enough for a potential overdose. The fact that they're putting xylazine in the drug supply now, xylazine is not reversible by Narcan. Just want to put that out there. But as back to co-occurring, the self-medication is a big part of why some people are using substance. And generally, for me, what happened is I went into detox, and when I was came off the drugs that I had been using, I went into psychosis, and then to see a psychiatrist, and they diagnosed me. It's really hard to diagnose someone accurately when they're using drugs. So it's important to be in recovery to get an accurate diagnosis and then be put on the proper medications. And I cannot stress how important therapy has played such an important role in my recovery, both from mental health diagnoses and from substance use.
And my last question is a little bit of a cliche, but I think you'll have an insightful answer. And what is the meaning of life to you?
The meaning of life. So, the way that I live my life is I try to be as Christ-like every day in every interaction that I have with every human that I come into contact with. I am a fan of love and building each other up and helping people not only see but attain good and positive things in their life. And my stepdad, who has been a tremendous mentor to me, there's a Bible verse that he has said to me several times in Matthew 6:33, I think it is seek ye first the kingdom of God and his righteousness, and all these things will be added unto you. That is one of the verses that I really try to live by. My step 3 in the 12 steps is we made a decision to turn our life and our will over to the care of God as we understand him. That was the experience I had in the back of that van from Dublin on my way to see Judge Giesler. And from that day on, I have tried to continue to live a life that is submitted over to the will of God, and when I interact with people as they come through these doors, I try to meet and greet and interact with them from a place of love and wanting what's best for them. I don't know if that's an adequate answer or not.
That's a great answer. Well, thank you, Pastor Harrod. It's been an honor to talk to you today, and thank you for reaching out.
Absolutely. It's my pleasure. I appreciate you taking the time.
Yeah, thank you.